There's a question that thousands of men secretly ask Google at 1 a.m., but almost never ask their doctor. What's happening to my penis, and is it too late to fix it? If you're over 50, maybe you've noticed it too. Your erections aren't as strong or spontaneous. Morning wood is rare. Sex feels like work, not pleasure. And deep down, a little voice in your head whispers, "Is this just aging? Or is something actually wrong?" I get it. I'm a urologist, and I've had this exact conversation with thousands of men. And let me tell you something that most doctors don't say out loud. Your penis is one of the best indicators of your overall health. When it starts to change, it's not just about sex, it's your body sounding an alarm. In today's video, I'm going to walk you through the 10 common mistakes that silently damage your penis, especially after 50, and exactly what you can do to fix them. Some of them are physical, some are emotional, and some might surprise you. But by the end of this video, you'll not only understand your body better, you'll have practical, science-backed ways to take control of your performance, your confidence, and your long-term vitality. Let's start with mistake number 1, and why your penis might actually be the first place to detect heart disease. The DIY trap. What you think helps your penis is actually hurting it. Let's talk about something that many men won't admit out loud, but secretly wonder all the time. Is there a way to make it bigger, harder, or better without going to a doctor? If you've ever been tempted by a late-night ad promising miracle growth, or a YouTube video teaching you how to increase size naturally in 7 days, you're not alone. But here's the truth. Some of the things men try to help their penis are actually doing long-term damage. I've seen it firsthand in my clinic, and the stories are often heartbreaking. Take jelqing, for example. It's a stretching technique some guys find online, where they use intense hand pressure to supposedly increase length or girth. It might seem harmless, but what I've seen in practice tells a very different story. One of my patients, a 56-year-old gentleman, came in after 6 months of doing exercises he read about on Reddit. What he didn't know was that he was causing micro tears in the delicate erectile tissue. His erections were weaker, and he had developed a curve from scar tissue forming. Sadly, some of that damage wasn't reversible. Then there's the DIY constriction band approach, using things like rubber bands, rings from plastic bottles, even metal nuts to maintain erections. One man ended up in the ER after passing out while using a homemade ring. His penis was so swollen we had to call the fire department with a specialized tool to cut it off. These aren't rare cases. They're common. And they're preventable. I understand where these actions come from. When men feel like they're losing control of their performance, they start looking for fast fixes. And the internet is full of solutions that prey on those fears. But there's no shortcut to real improvement. The truth is, if something seems too good to be true, or if it sounds like a secret no doctor wants you to know, it's probably unsafe. The lesson here is simple. Don't go it alone. There are medically tested tools and techniques that can help, but they need to be done safely, with the right guidance. Your health is too valuable to gamble with. Coming up next, let's talk about something even more overlooked. How to properly clean your penis, especially if you're uncircumcised, and why it matters more than you think. Clean but not too clean. The right way to care for your penis. Most men assume that cleaning their penis is simple. Just wash it like the rest of your body, right? But after 50, your skin becomes more sensitive. Your immune response isn't quite what it used to be, and the way you care for your genitals can have a bigger impact than you think. The truth is, a lot of men either don't clean enough, especially under the foreskin, or they clean too aggressively, and both can cause problems you definitely want to avoid. I had a patient in his early 60s who came in complaining of redness, soreness, and cracking skin. He'd been scrubbing with an antibacterial soap twice a day, thinking he was doing the right thing. But what he didn't realize was that he was stripping away his natural oils and irritating the thin, delicate skin of his penis, leaving it vulnerable to microtears, infections, and inflammation. On the flip side, I've seen men, especially those who are uncircumcised, who never learned how to properly clean beneath the foreskin. That moist enclosed area can build up smegma, a mix of dead skin and oils, which can lead to unpleasant odor, irritation, and in some cases an infection called balanitis. In rare cases, chronic inflammation in that area has even been linked to penile cancer. One gentleman, age 68, hadn't been able to retract his foreskin for years due to tightness and discomfort. When he finally came in, we found an ulcer that had been hidden, and it turned out to be cancerous. Fortunately, we caught it early, but many men aren't so lucky. So what's the right approach? Keep it simple. Use warm water and a mild, unscented soap. If you're uncircumcised, gently pull back the foreskin, rinse underneath, and dry thoroughly before returning it to position. Don't scrub, don't use alcohol-based wipes, and avoid anything that smells like a scented candle aisle. This isn't about being overly cautious. It's about respecting your body's design and aging skin. Remember, your penis is like any other part of your body. It deserves regular attention, care, and awareness. And that brings us to something even more critical, knowing when to speak up. Because the next mistake many men make is ignoring pain, ulcers, or blood, and waiting too long to do anything about it. Let's talk about that. Pain, ulcers, or blood. What you must never ignore. Let's be honest. Most men don't rush to the doctor at the first sign of something wrong, down there. Whether it's pride, embarrassment, or fear, we tend to wait it out, hoping the problem goes away on its own. But when it comes to your penis, waiting can be the worst thing you do. Pain, sores, or blood, especially in your urine, are not just minor annoyances. They can be signs of serious underlying issues. And the longer you ignore them, the greater the risk. I once treated a 63-year-old man who noticed a small ulcer on the head of his penis. It didn't hurt much, so he chalked it up to friction and forgot about it. 6 months later, it had grown, and he finally came in, reluctantly. The diagnosis? Penile cancer. We were able to treat it, but he lost part of his penis in the process, something that might have been avoided with early care. Other men ignore blood in their urine, thinking it's just from working out too hard or dehydration. But blood can be a sign of bladder cancer, kidney stones, or a urinary tract infection. One of my patients, age 59, came in after seeing blood in the toilet 3 different times over 6 weeks. Turned out, he had an early-stage tumor in his bladder, something we were able to remove completely. If he had waited a few more months, the story might have ended very differently. The message here is simple but powerful. Pain is a signal, not a nuisance. Ulcers are never normal. Blood should never be ignored. And most importantly, you deserve care without judgment. If your doctor ever makes you feel ashamed or brushed off, find another one. Your health and dignity matter, and the earlier you take action, the better your outcome. So while some problems may feel uncomfortable to talk about, silence is the real danger. Now that you know what not to ignore, let's shift gears and talk about something that can actually make your sex life safer and more enjoyable. How being in control during intimacy can prevent one of the most painful injuries a man can experience.
The safe sex rule that saves your performance.
Let's talk about something that doesn't get said enough. Safe sex isn't just about avoiding STDs or unplanned pregnancies. It's about protecting your performance, your confidence, and even your anatomy. Yes, literally. Because when sex gets too rough, too rushed, or too out of control, your penis can pay the price in a very painful way. I once treated a 61-year-old man who came into the ER holding an ice pack to his groin, pale and sweating. He and his partner were in the middle of an intense moment when he missed the mark and hit her pelvic bone. He heard a loud pop, followed by excruciating pain and rapid swelling. What he had experienced was a penile fracture, a real and urgent medical emergency. It's not a broken bone because the penis doesn't have any, but it's a tear in the tough tissue that holds the erection firm. Left untreated, it can cause permanent erectile dysfunction, curvature, or scarring. Thankfully, he came in quickly and had surgery the same day, and yes, he made a full recovery. But here's the lesson. Staying in control during sex doesn't make you boring, it makes you smart. One way to prevent injuries like that is to be mindful of your angles and speed, especially during vigorous positions. Use your hands on your partner's hips to guide movement. And let's not forget about lubrication. As we age, natural lubrication tends to decrease, especially in female partners going through menopause or taking certain medications. That doesn't mean they're not into it, it just means you need a little help. Lube reduces friction, enhances sensation, and helps protect both partners from micro tears and discomfort. And trust me, nothing ruins intimacy like unexpected pain. Remember, great sex after 50 isn't about performance tricks. It's about comfort, communication, and chemistry. When you're not worried about injuries or mishaps, you can actually let go and enjoy the moment. And when that happens, your confidence skyrockets. And so does your satisfaction. Coming up next, let's talk about a danger you might not even feel, yet it can silently damage your hormones, sperm, and long-term vitality. And it starts with one word: heat. Heat kills, the silent danger of saunas, laptops, and tight underwear. Here's something most men never think twice about: heat. Not just the weather, but everyday sources of warmth that slowly, quietly chip away at your hormonal health, your fertility, and yes, even your sexual performance. The problem is, the damage doesn't happen overnight. It builds up over time, just like pressure in a pipe, until one day you notice your drive is down, your energy is off, and your erections don't feel quite the same. Let's break this down. Your testicles live outside your body for a reason. They need to stay a few degrees cooler than your core temperature to produce healthy sperm and maintain optimal testosterone levels. When they're constantly exposed to heat, like from saunas, hot tubs, heated car seats, or even a laptop sitting on your lap, you're messing with that delicate system. I once had a patient in his mid-50s who had been trying to conceive with his second wife for almost a year. His lifestyle seemed healthy, non-smoker, active, but he used a hot tub daily for stress relief. When we tested his sperm, the count was drastically low. He cut back the hot tub sessions, switched to looser underwear, and within months, things improved. And it's not just sperm. Studies show that prolonged heat exposure can suppress testosterone production. That means less energy, lower libido, and increased fat storage, especially around the belly. Combine that with tight-fitting briefs or synthetic fabrics that trap heat and moisture, and you've got a recipe for chronic irritation and hormonal disruption. So what's the fix? It's easy. Limit sauna or hot tub time to occasional use. Keep laptops on desks or cooling pads, not on your thighs. Choose breathable cotton underwear or boxer briefs that allow airflow. And if you've been dealing with fatigue or a drop in sexual function, talk to your doctor about testing your testosterone. It might not be age, it might be heat. Your testicles are small, but their job is huge. Protecting them means protecting your manhood from the inside out. Next, we'll tackle something a little more personal: your solo habits. Because the way you've been masturbating might actually be numbing your arousal with a grip that your partner can't compete with. Let's talk about the death grip and what to do about it. Breaking the death grip: why your solo habits might be hurting you. Let's talk about something personal: masturbation. It's normal, healthy, and for many men, an important part of sexual well-being. But like anything, how you do it matters. And if you've developed a habit that includes a tight, fast, intense grip, what many men and experts call the death grip, you could be unknowingly training your brain and body to respond only to that kind of stimulation. Over time, that can make it harder to get aroused with a partner, maintain an erection, or even reach climax during sex. Here's what's happening. Your brain adapts. When you consistently use a certain pressure or rhythm that's much more intense than real-life intimacy, your nerves become desensitized to anything less. Your penis and your mind stop responding to the more subtle, natural sensations of partner sex. I've worked with a patient, 58 years old, who had a loving partner but was secretly relying on solo sessions to feel satisfied. Over time, he noticed sex felt less enjoyable, even disconnected. It wasn't until we gently discussed his habits that we uncovered the root. Years of death grip masturbation had rewired his arousal patterns. The good news? It's reversible, but it takes awareness, intention, and a shift in approach. Start by easing off the pressure. Literally. Use lube to reduce friction, slow down, focus on pleasure instead of release, and most importantly, let go of shame. You're not broken, you're human. These patterns form over decades, and adjusting them is part of reconnecting with your body and rediscovering intimacy in a healthier, more responsive way. If you're in a relationship, involve your partner. If you're not, use this as a chance to reset how you experience pleasure. Masturbation isn't just a physical act. It's part of how you condition your sexual identity, especially as you age. Be kind to yourself. Be patient. And remember, this isn't about performance, it's about connection. Speaking of long-term health, let's move from habits to lifestyle. Because no matter how well you clean, protect, or touch your penis, if your overall health is declining, so will your erections. And one of the biggest enemies? Smoking. Let's talk about that next.
Use it or lose it. Why erections need regular maintenance. There's a saying you've probably heard. Use it or lose it. When it comes to your erections, especially after 50, that phrase isn't just catchy, it's biologically true. You see, your penis isn't just a tool for pleasure. It's made of living tissue that needs regular blood flow and oxygen to stay strong, flexible, and functional. And if that tissue goes too long without being exercised, it can begin to weaken, just like any other muscle in your body. Here's how it works. Most healthy men have 3 to 5 spontaneous erections every night during REM sleep. These nighttime erections are your body's natural maintenance system. They send fresh, oxygenated blood to the penis, keeping the tissue elastic and the nerves responsive. But when testosterone drops with age, or when men stop engaging in sexual activity, whether from stress, relationship issues, or performance anxiety, those nighttime erections can become infrequent or disappear altogether. That's when the trouble starts. Without regular erections, the penile tissue may begin to stiffen, scar, and in some cases, even shrink. I've seen it happen more than once. A man in his early 60s reports that his penis feels shorter or less full, and often it ties back to a long period without arousal or sexual activity. But don't panic, this is something you can take action on. The key is to keep blood flowing regularly, either through intercourse, solo stimulation, or medically supported options like vacuum erection devices, VEDs, which gently increase circulation. Some men also benefit from low-dose medications that support natural blood flow. The point is, activity matters. It doesn't always have to be about sex. It can be about staying connected to your body and keeping the engine running. And if your sex drive feels lower than it used to, that's worth exploring too. Low desire can stem from hormonal changes, stress, or even depression. But with the right guidance, it's often treatable. You deserve to enjoy intimacy, connection, and confidence, no matter your age. Ending CTA. Soft but actionable.
Here's what I want you to take away from all of this. Your penis is more than just a part of your body. It's a reflection of your health, your confidence, and your quality of life. The changes you may be noticing after 50 aren't random. They're signals. And the good news is, you can do something about them. Whether it's adjusting how you care for yourself, changing harmful habits, or just starting a conversation with your doctor, every small step matters. So here's my challenge to you. Pick just one thing from this video, just one, and take action on it this week. Maybe it's switching to looser underwear, maybe it's giving up the late-night DIY tricks, maybe it's finally scheduling that checkup you've been putting off. Whatever it is, your future self will thank you. And if this message hit home for you, if you saw yourself in any part of this story, know that you're not alone. Millions of men are navigating this chapter quietly, but you don't have to. Start small, stay curious, and keep going. In the next video, we're diving deep into something even more personal. What actually happens when you stop masturbating after 50. The science might surprise you. I'll see you there.